Struggling with mental health can feel overwhelming and deeply challenging. It can affect various aspects of your life, including your emotions, thoughts, behaviors, relationships, and overall well-being. Mental health struggles can manifest as intense and fluctuating emotions such as anger and sadness, anxiety, guilt, or numbness. You may feel overwhelmed by these emotions and struggle to cope with them effectively. Mental health issues can also manifest as physical symptoms such as headaches, fatigue, muscle tension, digestive problems, and changes in appetite and sleep patterns. These physical symptoms can further exacerbate feelings of distress and discomfort. Mental health struggles can impact your ability to think clearly, concentrate, make decisions, or even remember things. You may experience racing thoughts, intrusive thoughts, or difficulty focusing on tasks. Mental health challenges can influence your behavior, leading to changes in the habits, routines, and coping mechanisms. You may engage in avoidant behaviors, self-destructive behaviors, or substance abuse as a way to cope with distress. Mental health struggles can sometimes lead to social withdrawal or isolation. You may feel disconnected from others, having difficulty relating to friends and family, or avoid social interactions due to feelings of shame, fear, or inadequacy. Mental health issues can strain relationships with loved ones, leading to misunderstandings, conflicts, or feelings of distance. Communication may become challenging, and you may struggle to express your needs or understand the needs of others. You may feel trapped in a cycle of distress, believing that things will never improve or that you're powerless to change. Mental health challenges can interfere with your ability to perform daily tasks, fulfill responsibilities, or engage in activities that you enjoy. This can lead to feelings of frustration, inadequacy, or guilt about not being able to meet your own or others' expectations. Unfortunately, stigma surrounding mental health can enhance feelings of shame, self-blame, or inadequacy. You may hesitate to seek help or disclose your struggles to others due to fear of judgment or rejection. It's important to remember that struggling with mental health is a common and valid experience, and you are not alone. There is help and support available, and recovery is possible with the right resources and treatment. People's reactions to individuals with mental health problems can vary widely depending on their level of understanding, empathy, and personal beliefs. Many people respond with empathy, compassion, and support when they learn that someone is struggling with mental health issues. They may offer a listening ear, encouragement, and practical assistance in seeking help or managing symptoms. Some individuals may react with misunderstanding or lack of knowledge about mental health. They may hold misconceptions or stereotypes about mental illness, leading to stigma, discrimination, or dismissive attitudes towards those who are struggling. This stigma may stem from fear, ignorance, or societal beliefs about mental illness as a sign of weakness or personal failure. Some people may feel uncomfortable or unsure of how to respond to someone with mental health issues, and may therefore avoid the topic or distance themselves from the individual. This can further contribute to feelings of isolation and shame for the person struggling. Others may downplay or minimize the severity of mental health issues, dismissing them as a temporary or not a significant concern. This response can invalidate the person's experiences and feelings, making it harder for them to seek help or feel understood. Empathetic individuals may actively listen, validate, and empathize with the struggles of someone with mental health issues. They may offer emotional support, validate the person's experiences, and express understanding without judgment. Some people who are well informed about mental health may respond with educated and supportive attitudes. They may offer practical assistance, resources, or referrals to help the person access appropriate treatment and support. Unfortunately, some individuals may respond to mental health struggles with blame, criticism, or accusations. They may attribute the person's difficulties to personal weakness, laziness, or lack of willpower, which can further enhance feelings of shame and self-blame. Reactions to mental health issues can be influenced by a variety of factors, including cultural beliefs, personal experiences, and social attitudes. While negative reactions and stigma can be hurtful and challenging to navigate, there are also many supportive and empathetic individuals and resources available to provide assistance and understanding. Living with mental health problems can be challenging, but there are many strategies and resources available to help you cope and thrive. I'll give you some tips for managing mental health issues. Reach out to a mental health professional, such as a therapist, a counselor, or a psychiatrist. They can provide assessment, diagnosis, treatment, and ongoing support tailored to your specific needs. Learn as much as you can about your mental health conditions and treatment options. Understanding your symptoms, triggers, and coping strategies can empower you to take an active role in managing your mental health. Surround yourself with supportive friends, family members, and peers who understand and validate your experiences. Having an active support system can provide emotional support, encouragement, and a sense of belonging. Prioritize self-care activities that support your physical, emotional, and mental well-being. This can include exercising, healthy eating, getting sleep, relaxation techniques, hobbies, and activities that bring you joy and fulfillment. Establishing a regular daily routine can provide structure, stability, and a sense of control, which can be beneficial for managing mental health symptoms. Try to maintain consistent sleep, meal, and activity schedules to support overall well-being. Break larger goals into smaller, manageable tasks and set realistic expectations for yourself. Celebrate your achievements, no matter how small, and be gentle with yourself when setbacks occur. Identify and minimize sources of stress in your life as much as possible. This may involve setting boundaries, delegating tasks, saying no to additional responsibilities, or seeking support when needed. Participate in therapy or counseling sessions. Regularly explore your thoughts, feelings, and behaviors in a safe and supportive environment. Therapy can help you develop coping skills, improve self-awareness, and work through challenges. Stay connected with others and maintain social connections, even when you're not feeling your best. Reach out to friends and family members or support groups for companionship, understanding, and encouragement. Engage in activities and hobbies that you enjoy and that promote a sense of purpose and fulfillment. This can help distract you from negative thoughts, boost mood, and enhance overall well-being. Keep track of your mental health symptoms, triggers, and coping strategies using a journal or mood tracking app. Monitoring your mental health can help you identify patterns, track progress, and communicate effectively with your treatment team. Remember that managing mental health problems is an ongoing process, and it's okay to seek help and support when you need. You are not alone, and there are resources available to assist you in your journey toward improved mental health and well-being. Managing mental health problems can feel like a complex and ongoing journey with both ups and downs. Taking proactive steps to manage your mental health can evoke feelings of empowerment and control. Engaging in therapy, practicing self-care, and seeking support can help you feel more in charge of your well-being. Despite the challenges, managing mental health problems can instill a sense of hope for the future. Setting goals, seeking treatment, and experiencing moments of improvement can inspire optimism and belief in your ability to overcome obstacles. Managing mental health problems can also be frustrating at times. especially when symptoms persist despite efforts to cope and heal. It's common to feel frustrated with setbacks, slow progress, or challenges in finding effective treatment. Engaging in therapy and seeking support can provide validation for your experiences and feelings. Feeling understood, accepted, and validated by others can be incredibly validating and affirming. Finding effective coping strategies, treatment modalities, or support networks can bring a sense of relief for mental health symptoms. Moments of relief can provide a respite from distress and remind you that healing is possible. Despite efforts to seek support, managing mental health problems can sometimes feel isolating. Feelings of shame, stigma, or misunderstanding from others may contribute to a sense of loneliness or social withdrawal. Making progress is managing mental health problems, no matter how small. It can evoke feelings of pride and accomplishment. Celebrating your achievements and resilience can boost self-esteem and motivation. Engaging in therapy and opening up about your struggles can evoke feelings of vulnerability and discomfort. It's normal to feel exposed or apprehensive about discussing sensitive topics, but doing so can also foster growth and connection. Experiencing support, understanding, and compassion from others can evoke feelings of gratitude and appreciation. Recognizing that kindness and generosity of others can cultivate a sense of connection and belonging. Managing mental health problems is a complex and nuanced process that involves a range of emotions and experiences. It's important to acknowledge and validate your feelings, seek support when needed, and celebrate your progress along the way. Remember that you are not alone, and that there are resources and people available to support you in your journey towards better mental health.